There is an exercise for the area under your chin that has genuine clinical research behind it. Randomized controlled trials, published in medical journals, used in hospitals and rehabilitation clinics around the world. I am going to teach it to you in this video, and it takes about 5 minutes a day. But I have to be honest with you about something first. That research is not about appearance. The exercise was developed for a different reason entirely. And in my opinion, that reason is far more important than a jawline. I will explain both. So let me start with the honest part, because you deserve it before you spend 5 minutes a day on anything. What most people call a double chin is not one thing. It is three, and they respond very differently. The first is submental fat. That is fat sitting between the skin and the muscle underneath your chin. Where your body stores fat is heavily genetic. Some people carry it there at a perfectly normal weight and always have. The second is skin laxity. From your mid-20s onward, your skin loses collagen and elastin steadily. And after menopause, that loss accelerates. Skin that once snapped back simply does not anymore. The third is posture, and this one is genuinely underappreciated. When the head sits forward of the shoulders, which happens as the upper back rounds with age, the skin and soft tissue under the chin bunch and fold. The same person standing tall and standing slumped can look noticeably different with no change in tissue at all. So now the difficult truth. There is no such thing as spot reduction. You cannot direct fat loss to one region by exercising the muscle beneath it. Muscles do not consume the fat sitting on top of them. If that worked, chewing gum would give people slim faces, and it does not. And exercise does not restore collagen or tighten loose skin. So when a video promises that an exercise will melt fat under your chin, that is not how the tissue works. What exercise can do is strengthen and slightly enlarge the muscles underneath and improve the posture that makes the fold worse. Both of those change the appearance somewhat. Neither is dramatic. Now let me tell you what the actual evidence says, including the study everyone quotes. In 2018, Dr. Murad Alam and colleagues at Northwestern published a research letter in JAMA Dermatology. Women aged 40 to 65 performed 32 facial exercises for 30 minutes daily for 8 weeks, then every other day through week 20. Blinded dermatologists rated before and after photographs. They estimated the participants looked on average about 3 years younger, with measurable gains in upper and lower cheek fullness. That sounds impressive, and it made headlines worldwide. Now, here's what the headlines left out. 16 women completed it. There was no control group. There was no blinding of participants. There were significant dropouts. And the lead author himself said the effect was modest and that larger studies were needed. Notice also what improved: the cheeks, not the area under the chin. The proposed mechanism was muscle growth pushing the fat pads of the cheek upward, which is a real thing but is not the same as tightening a jawline. So I am not going to tell you that facial exercises will remove a double chin, because the evidence does not support that. What I will tell you about is a different exercise with much better evidence for a much better reason. If this honesty is useful to you, tell me in the comments. I read them. The exercise is called Chin Tuck Against Resistance, abbreviated CTAR. It was developed from an older technique called the shaker exercise, which required lying flat and repeatedly lifting the head, and which many older adults found difficult and uncomfortable. CTAR does the same work sitting up. Here's how you do it. Sit upright in a chair with your back supported and your shoulders relaxed. Take a small inflatable ball, roughly the size of a grapefruit, and place it between your chin and your chest. A rolled towel or a small cushion works if you do not have a ball. Now tuck your chin down and press firmly into the ball, as though you are trying to squeeze it flat. You should feel the muscles directly under your chin engage and tighten. That is exactly the group you are targeting. There are two versions. For the sustained version, press and hold for about 10 seconds, then release, and repeat around 10 times. For the repetitive version, press and release in a steady rhythm about 30 times. A common protocol combines both 3 times a day. Now let me tell you why this exercise exists. And this is the part of the video that actually matters. The muscles under your chin are called the suprahyoid muscles. Their job is not cosmetic. When you swallow, they lift your voice box upward and forward, which pulls open the top of your esophagus and, critically, closes off your airway, so food goes down the right tube. Those muscles weaken with age like every other muscle. When they weaken enough, swallowing becomes less safe and food or liquid can enter the airway. Doctors call that dysphagia, and it is common and badly underrecognized in older adults. Its most serious consequence is aspiration pneumonia, where material entering the lungs causes infection. That is a leading cause of hospitalization and death in frail older people. And here's the evidence. A randomized controlled trial published last year in European Geriatric Medicine enrolled 64 community-dwelling older adults with an average age of 81 who had age-related swallowing difficulty. All of them received oral flexibility training, and one group additionally performed progressive chin tuck against resistance. The group doing the CTAR exercise showed greater improvement in swallowing assessment scores and in swallowing-related quality of life. Other studies using surface electromyography have confirmed that CTAR activates the suprahyoid muscles more specifically than the older shaker method. So this is a real exercise with real trials and a real clinical purpose. Does it also affect appearance? Strengthening those muscles may modestly firm the contour under the chin, and better posture from the chin tuck position genuinely helps how that area looks. But I would be overstating the evidence if I promised you a transformed jawline, and I am not going to do that. I would rather you do it because it may keep you swallowing safely at 85. Now, 3 things that genuinely do affect how that area looks, in honest order. First, posture, and this is the most underrated. Strengthening the upper back and stretching the chest counteracts the forward head position that creates and deepens the fold. Rows, wall angels, and simply being conscious of standing tall. This is free, it changes appearance immediately, and it helps your balance and your breathing as a bonus. Second, sun protection. Ultraviolet exposure is the single largest driver of collagen breakdown in skin, and the neck and under chin area is chronically neglected because people apply sunscreen to the face and stop at the jaw. The damage is cumulative and it is not reversible. So protection matters more than repair. Third, if this genuinely bothers you, medical options exist and they work better than exercises. There are injectable treatments that dissolve submental fat, energy-based skin tightening devices, and surgical options. I am not endorsing any of them, and they carry cost and risk. But if this matters enough to you that you are searching for exercises, an honest consultation with a board-certified dermatologist or plastic surgeon will tell you more than I can. Now, the part I want you to hear most, not every fullness under the chin is fat. Please pay attention to this. A lump under the jaw or in the neck that is firm, does not move easily under the skin, is growing, or has been present for more than 2 to 3 weeks, needs to be examined, especially if it is on one side only, especially if you have ever smoked or been a heavy drinker. Swelling under the jaw that comes on with eating or is painful can be a salivary gland stone or infection. Diffuse swelling at the front of the neck that moves when you swallow may be a thyroid problem. Hoarseness lasting more than 3 weeks, difficulty or pain swallowing, unexplained weight loss, or a persistent sore throat on one side all warrant a proper examination. And puffiness under the chin and around the eyes that appeared over weeks rather than years can indicate thyroid or kidney issues. None of that is a cosmetic problem, and none of it should be treated with an exercise from a video. I am not saying this to frighten you. The large majority of neck lumps are benign, but head and neck cancers are more common with age, and they are frequently caught late precisely because a lump gets watched for months. 3 honest statements before I close. Spot reduction is not real, and no exercise removes fat from a specific area. The facial exercise evidence is limited to small studies without control groups, and I have told you exactly what it shows. And this video is education, not medical advice. I am a physician, but I am not your physician. Here's what I would say to a patient who asked me this in my office. I understand why you want it, and there is nothing vain or foolish about wanting to look like yourself. But the exercise I taught you today has stronger evidence for keeping you out of the hospital than for changing your photograph. That is not the answer you came for. It is the truthful one, and it is the more valuable one. Do the chin tucks, stand up straight, wear sunscreen on your neck, and if there is a lump that is firm or growing or has been there more than 3 weeks, please stop reading about jawlines and make an appointment. Tell me in the comments whether you have ever had trouble swallowing pills or coughed while drinking. That is more common than people admit, and it is treatable. Take care of yourselves, and I will see you in the next one.